Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
It's Ready, Set, Glow time. This is our second in our series of how to get glowing skin. If you missed the first one, go back to episode 9 where I talked to Lana Kerr about using the CO2 lift to get glowing skin. And today I'm here with one of our skincare experts in our practice, Madison McFall, and we're going to talk about my second recommendation of how to get glowing skin, which is DiamondGlow. Welcome, Madison.
Hey, I'm excited.
Yeah, so what is glowing skin, first of all, is if you've ever looked at younger people of adolescents, girls or people in their 20s, you can see that their skin almost has a glass-like appearance to it, where it's just really smooth. There aren't a lot of discolorations, fine lines and wrinkles, and really the light just reflects off of it. And it's really a sign of youthful skin. I mean, who doesn't want to be told, you're just glowing today? What a great compliment.
Oh, seriously, the best compliment.
Yeah. So I think there's a few things that can help with this. And today we're going to talk about DiamondGlow. And Madison, you're one of the skincare specialists in our practice that actually perform the DiamondGlow. And so if you just want to explain to our listeners, well, what is DiamondGlow?
Yeah, so I do a lot of DiamondGlows pretty much every single day. It's probably my favorite treatment that we have. It is a tool that has a few different things that go along with it. So it is infusing serums, exfoliating, and extracting at the same time. So that has a diamond tip grit that we use. We have a custom setting for each patient of a level of how gritty versus how sensitive their skin is or how tough their skin is. The grit is probably one of the most important things, because if I'm using a light grit but someone has tough skin, it's not going to really help with the overall texture. And I feel like even if you have...
what does the grit mean for people who don't even know what that means?
Yeah. So think of almost like how rough like a sandpaper thing would be, but it's not as tough as that. But it kind of is like a rough little metal tip. The lower the number, actually, the rougher the tip is. And then the higher the number, the more smooth it is. So we use one that's pretty much completely smooth. There's no grit when we do it around the lips and the eyes, the more sensitive places. But for pretty much the rest of the face and the nose and the neck, we would use a grit level depending on how tough their skin is.
Yeah, so you customize it for the individual patient. So,
exactly.
But it definitely doesn't feel like sandpaper kind of across your skin.
Exactly. It feels, I think Dr. Tiemann had the best explanation, where it almost feels like how a cat's tongue is like slightly rough, but it's not painful. Most people actually, when I'm doing the treatment, they say they love how it feels. It just almost feels like a massage. But yeah, if you are someone who has like rosacea, anything where there's, more sensitive skin, we would do something more sensitive. But we use a little bit of a suction tool. It has a little bit of suction in it. So the idea is as we're exfoliating, kind of going over the skin, it'll clean out your pores. It'll suck in any debris, all the dead skin that we're kind of getting off. And then once we get to that layer underneath, that is where that nice, as you said, like glass-like skin is kind of underneath. We have a lot of different serums that we can use to help brighten over their overall complexion, clean out their pores.
Yeah, so what are the choices for the different serums we can infuse into the skin?
Yeah, so we have 4 kinds in our office. We have the skin brightening, which uses Lumixil to kind of just brighten pigment or hyperpigmentation.
So if people have sun damage, that's the one you go to.
Absolutely. We have the vitamin C, which helps hydrate, helps a little bit with hydration as well with the skin, helps protect against free radical damage. We have the ultra hydrating, which uses the hyaluronic acids to just really help plump and hydrate the skin. Hyaluronic acid is a serum that helps your body maintain the moisture and lock in moisture. So it's not necessarily a moisturizer by itself, but it's meant to help your body retain water and retain moisture and help plump the skin. And then lastly, we have the pore clarifying, which is what we would use if someone's prone to acne or even just clogged pores, blackheads, and it's going to help kind of clean out those pores.
And we have the TNS serum too.
Yeah, we're supposed to be getting that one in again soon.
It was
that
on back
one,
order. Mm-hmm. So because it's so popular,
exactly.
It's like the number one bestseller in Skinmedica for a take-home product.
Yeah. So the TNS, it is critically important that patient uses the TNS Advance at home daily. So you need to be using that morning and night. If you're using it just for a maintenance treatment, it's not going to give you the full effect. So when you're using it, you're not going to be impressed if you're just doing it once every 2 weeks, 4 weeks. You definitely have to be using that morning and night, but that uses human growth factors, and human growth factors are what helps really repair the skin and really makes you look more youthful again. So if there's a lot of breaks in the skin.
It's the only skincare product that I know that actually can help with sag or sagging skin.
Oh yeah, the only one. And even I think there's not even many products. I think there's one other medical brand that even uses human growth factors. Any other product you find is going to be synthetic growth factors, plant-based growth factors, which aren't going to do that much for you.
So if I'm here, if I'm a patient, I'm listening to this, I'm like, oh, well, I have all of those problems. Like I have pores on my face that you can see. In fact, I remember one time when my daughter was like 7, she's like, Mom, what are all those like black dots on your face? I'm like, yeah, that's great.
Oh my God.
Those are,
Kids are
my big pores.
Yeah. So we can do 2 serums at a time. It has 2 different sections where we can pull and I can switch what serums we're using, which is definitely important because the pore clarifying, like I can't use that near your eyes. So we would use like a vitamin C or ultra hydrating, something that's gonna be a little bit more sensitive to kind of just help hydrate and can help brighten a little bit under your eyes. If people have more than one, I mean, even just doing the DiamondGlow in general is still going to help clean out your pores. Like we used the vitamin C and ultra hydrating on me because I have rosacea, I have sensitive skin. A lot of things bother me, but I still noticed a huge difference with like the little bumps that I get on my forehead, with the blackheads on my nose. We can show you your jar and you'll even see that you'll see a lot of the little floaties in there and all the gunk that we sucked out of your face.
I personally, as a doctor, like love that stuff of, like I love popping zits. I love dealing with abscesses. So I get a lot of satisfaction of actually looking at the jar of all of the gook that came out of my face.
Oh yeah. I know
Patients love that too.
Oh
don't
yeah.
they?
Oh yeah. I ask them every time. I'm like, do you want to see what's in your jar? Like it collects everything and I can show you at the end. And everyone always is like, oh yeah, show me, please show me. Like everyone immediately gets off the bed to look at it. I think it just also gives you more satisfaction knowing like, okay, this is doing what it says it does. Because I feel like you can tell someone this does what I'm telling you it does, but they're not going to believe it until they try it or until they see it. So I think actually seeing that it collects it in that jar, I think that was so smart of them to put that right there where we can show patients, because it just makes you feel better knowing like, okay, that's all came out of my face. I mean, it's a little gross, but at least you know, like, all right, it's doing its job. And then people want to come back and do it regularly.
Yeah. So you mentioned that since we brought this into our practice, that this is a big favorite of patients, and it instantly, like, people just love it. Why do you think that is?
You instantly have that gratification of seeing the results right away. There's some treatments where, you know, it kind of takes time. Like doing a peel, you might peel for a few days and then later you're like, okay, yeah, this is why I do this. The DiamondGlow, immediately I tell patients, like, if you want to wash your hands and touch your skin, so I'll have people wash their hands right at my sink and feel with the back of their hand, their skin, and they're like, oh my God, my skin is like softer than it's been in years. Or I give them a mirror to have them look too, but you just instantly just can tell a huge difference with your skin.
Yeah, so it's a great treatment to, like, before an event, before a wedding, before a vacation.
Oh, absolutely. I had a girl, and what's great too is as long as your physician's fine with it, there's a few serums if you're pregnant. And like you said, I mean, most pregnant women, amazing glowing skin, but you get hormonal acne, a lot of other problems that you still stress over. But I had one girl doing it right before her pregnancy photos, and she was like, oh my God, like as soon as I saw my pictures, like my skin looked better than it had like my entire pregnancy. But it really helps especially if you have photos to be doing the next day. We usually tell people to do it like the day before, you know, and then it really just helps brighten your skin tone and make your skin look super soft.
Yeah. So how often, I know I personally like to get this, like, ideally I'd like it twice a month, but just I'm
with both
kind
of
of
our
busy.
schedules.
So I personally try to do it once a month, but how often are you recommending your patients to get it done? And before, you see that instant result, but how long does it take, or how many treatments if we're trying to treat other things like sag or pigment or...
So pigment is one of those tricky things where unfortunately it lives underneath your skin, and as soon as you're exposed to infrared heat, it draws it back out. So the idea is they would do something at home, and they would be using Tret and either Tret in the blender and then be using clear on the nights they're not using their Tret, which is the Obagi products that kind of help just brighten those pigment spots. But the idea is if they come in here and be doing this, I would prefer once every 2 weeks, especially if we're trying to correct something that's been done.
Or at least it's just especially at the beginning.
Absolutely, yeah. So if we can at least do like 6 to, a few more treatments for, depending on their pigment, but most people I'm like, let's at least do 6 if you can buy a couple packages of 3 and see how your skin looks, and try to work on a plan. We have these skin prescriptions where I try to lay out like, this is what you should be doing at home. This is what we should be doing, every couple weeks or every month. But I tell people at least let's try to knock out a few treatments, see where you're at. And then it just kind of depends on the person though. But for acne and a lot of those persistent problems, this is definitely something that would be good to do as regularly as you can, and just be alternating with a lot of the products you use at home. If you need something more aggressive, this can be alternated with other treatments that we do. We can do the advanced corrective peel, and then 2 weeks later do a DiamondGlow, and then 2 weeks later do a peel. And I think that is a really great plan to correct. So kind of really specific to the person. So that's why I love that we do the hour-long consults where I can really sit down with people and say, okay, this is what your goal is. This is where we're at. And then really make up a plan. And we can even lay out like, this is what you're spending in a year. And that way they're aware of how this is long-term and what it's going to do for their skin.
Right. Because there's no one and done. I wish there was like, okay, just do this one thing and,
you're perfect.
It's not that simple. So, because some people might need lasers or radio frequency or IPLs or you name it. But what is nice about this procedure compared to some of our other procedures in our practice is this feels good versus sometimes more the more invasive type things. There's a little bit of an ouch factor.
Oh, exactly. Yeah. This feels great on your skin, whereas a laser or the RF is a little bit more painful. So it definitely makes it a lot easier for people to come in and get this one done.
Yeah. And you can do this year round. So unlike some treatments you can't do when you have a tan or there might be some downtime with it.
Yeah, exactly. No downtime. Just for that day, as long as you can wait to wash your face to let those serums soak in. Of course, if you end up working out or something, wash your face. But if you can wait for that day and then the next day put on your makeup, do everything as if you didn't have a treatment done. Yeah, it's really great.
And then just last question, and I'll let you go, is because it's called a DiamondGlow facial, but it's not really a facial like you would get like when you go on vacation or something like that. Like, how is it different than just a regular facial? Because I used to tell patients I think facials feel good, and who doesn't want somebody to kind of rub your face and, it just is relaxing and feels good. But I've never been a believer that facials really do much to kind of change your skin.
Yeah, so this is like a next level facial. So it uses a recessed diamond tip, which is that grit that we talked about. And that's going to exfoliate your skin to just really help with more resurfacing. Because a lot of facials, it's not really doing as much resurfacing. It is just hydrating the skin. Sometimes they use chemical exfoliations, but for the most part, it's mostly about hydrating or using certain things just to correct little problems. But this is actually really resurfacing the skin, and that's what makes your skin feel so much softer, and then can over time really help to, like, soften some of those fine lines and wrinkles.
Alrighty. This was super helpful. Thanks for joining us.
Awesome. Thanks for having me.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.